Hello, I'm Karen Grace Clark, Program Chair of GOLD Lactation Online Conference. I'm here today with Dr. Frank J. Nice, and we're talking about breastfeeding and non-prescription drugs. Frank, can you tell me how a male pharmacist like yourself would become an expert?
Yes, Karen. Unlike today, where most pharmacists are females, back in 1976, when my first child was born, most pharmacists were males. And of course, being a father, I was able to see the importance of breastfeeding, the bonding, and all the benefits that a breastfeeding baby gets while breastfeeding. And I knew that medications had to be taken by some breastfeeding mothers, and I wanted to do all I could to make sure that the mother could take the medication and continue to breastfeed.
Excellent. Thank you for sharing that with us. You've obviously had quite a long career here, and we're really looking forward to learning more about that in your presentation. Can you tell me why this topic is important for lactation professionals around the world to learn more about?
Yes, just in the United States alone, over 1 million mothers who need to take a medication and want to breastfeed do not breastfeed. One of the main reasons that the mother stops breastfeeding is because she's given improper information, incorrect information about the medication itself. Basically, in over 99% of the cases, mothers can continue to breastfeed, continue to take the medication, and the baby and the mother all benefit from the benefits of breastfeeding.
1 million women in the USA alone. That is a stunning number, and I do understand that as a lactation consultant. I see that a lot, so I understand what you're saying. Another question for you, what main lesson have you learned over the years when consulting in medications and breastfeeding?
The main lesson I learned is that you never assume anything. Don't assume the mother knows everything about the medication, that she can take it. Don't assume even the healthcare professional, the lactation consultant, the pharmacist, the doctor has all the information. Each case is very individual. An example I can give in my pharmacy practice is a patient came into the store, we prescribed a suppository, the patient walked out, came back a couple days later, we asked him how he was doing. He said, well, this suppository just doesn't work, and I'll tell you, when I use it, it really hurts too. And what was he doing? He never took the foil off the suppository. So you can see, don't assume anything.
I shouldn't laugh, but that was a funny moment. You do have a really good point. It's getting the message across and making sure that people are understanding what we're saying. And I do believe that this topic is really, really important. So we're really looking forward to having you participate in GOLD Lactation 2013, Frank. I would like to remind all of our listeners that you can find out more information about our conference at goldlactation.com, and you can sign up to hear Dr. Frank Nice's presentation, Breastfeeding and Non-Prescription